behalf of the Wharton student body, I welcome you to this Friday morning session of the 17th Annual Wharton Healthcare Business Conference. The theme for this year's conference is Leadership in an Evolving Global Market. It is our hope that this conference will serve as a dynamic forum to freely exchange ideas, to build personal and professional relationships.
Most of our work, not all of it, is involving how you take business management and marketplace principles and apply those to global health to achieve the ends of global health, namely saving lives. Since our inception, we've been working on price reduction issues. Price is a key barrier to access in Africa, in Latin America, and Southeast Asia in terms of accessing HIV/AIDS treatment. So examples of work on that front include the following. Over the last 4 years, we've been fortunate to reduce the price of drugs for pediatric HIV/AIDS by between 80 and 92%. The price of gold standard, once daily, first line antiretrovirals has been reduced by about 50 to 60%. The price of second line drugs by about 30%. We've also done similar things in other spaces like malaria, where we've reduced some prices. But price is not the only barrier to access. You need rapid access to the best products at affordable yet sustainable prices. And sustainability is key there. If a manufacturer is not making at least a reasonable return, they're not going to be willing to continue in their business. So we think about rapid access, we think about quality, we think about a broad supplier base to enhance competition so that there's incentive for suppliers to continue to reduce prices or pursue other innovations. So how have we been able to reduce the price so dramatically? It's a multifold strategy. And involves everything from negotiation, making sure that companies have reasonable margins, not too high margins. And then it comes into thinking about what are the incentives of those companies. They may be willing to reduce their price if they can reduce their costs of production or the risks of doing business. So can we help them do that? We can help them do that by perhaps by involving others and enhancing their manufacturing process. In fact, we've pioneered, using our group of scientists, some methods to reduce cost by actually enhancing process chemistry on the actual synthesis of the drugs. Can you get lower priced raw materials, either through pooling of volumes or because we can encourage the entry of a new lower priced source of a raw material? So those are examples of cost of production reduction. And then, of course, there's risk reduction. I mean, we're dealing with risky marketplaces where there might be late payers, where there might be non-payers. So can we address that point? Can we forecast volume so that they can plan production and keep their costs low? And then, of course, there's the return aspect of it. Can we figure out a way to pool volumes on the demand side so that we receive volume-based discounts? So these are simple methods, and none of this is rocket science. These are all very simple push and pull methods that I think any business person would think about. And what we do is we set out to go and implement them. The suppliers in question that were willing to work with us happened to be the generic suppliers based in India, who were low-cost suppliers, which was helpful, based in India, based in China, but mostly based in India at the time. And what they did was they read our, the short of it is they read our business plans and they said, we get it, price is a barrier to access. So why don't you do 2 or 3 other things for us and we'll help to reduce the prices further. They said, deal with all of the late payment issues, forecast demand and let us control our costs. And that's where it went from an arm's length transaction to more of a partnership. And since then we've been pioneering process chemistry and doing other technical and business oriented things. And that's the story of how we started working on marketplaces. We're imparting the knowledge of what's worked and what hasn't worked to others. I don't think we should be the only ones doing this. Other people should be doing this. And I think taking the time to talk about successes and failures, talk about not only strategy, but the tactics that work and the tactics that failed is critical.